CEN Nursing Exam YouTube. Question 1. The nurse is assessing a patient with a suspected pulmonary embolism. Which finding is most consistent with this diagnosis? Productive cough with green sputum. Absent breath sounds on one side. Sudden onset pleuritic chest pain and tachycardia. Fever and chills. Question 2. A patient involved in a high-speed motor vehicle collision presents with hypotension, abdominal distension, and a positive FAST exam. The nurse anticipates emergent CT scan, immediate laparotomy, observation in the ED, administration of vasopressors. Question 3. A patient presents with severe hypertension, headache, and altered mental status. The nurse recognizes this as hypertensive urgency, hypertensive emergency, hypertensive encephalopathy, benign essential hypertension, subarachnoid hemorrhage. Question 4. A state senator is being treated in the ED, and a staff member discusses his care with a local reporter. The facility is most likely to face a lawsuit for false imprisonment, defamation, libel, invasion of privacy. Question 5. A patient presents with fever, chills, and a productive cough with rust-colored sputum. The nurse recognizes this as consistent with viral pneumonia, mycoplasma pneumonia, pneumococcal pneumonia, tuberculosis. Question 6. A patient presents with a sickle cell crisis and reports severe pain. The nurse should encourage oral fluid intake, administer a non-steroidal anti-inflammatory drug, administer opioids as ordered, apply a cold compress to the area. Question 7. A 2-year-old child presents with a barking cough, stridor, and respiratory distress. The nurse suspects epiglottitis, croup, foreign body aspiration, asthma. Question 8. A patient presents with sudden onset of severe, diffuse abdominal pain, vomiting, and a history of alcohol use disorder. The nurse anticipates an order for NG tube placement, serum amylase and lipase, abdominal CT, all of the above. Question 9. A patient presents with confusion, nausea, and a fruity breath odor. The nurse suspects diabetic ketoacidosis. The priority is to administer insulin, establish 4-access and begin fluid resuscitation, obtain a serum glucose, administer sodium bicarbonate. Question 10. A patient presents with a sudden onset of right-sided weakness, facial droop, and slurred speech. Last known well was 2 hours ago. The nurse anticipates emergent CT scan of the head, administration of aspirin 324 milligrams orally, continuous cardiac monitoring, all of the above. Question 11. A patient with a history of sickle cell disease presents with severe back and chest pain. The nurse suspects musculoskeletal strain, vaso-occlusive crisis, pulmonary embolism, myocardial infarction. Question 12. A patient with a history of alcohol use disorder presents with confusion, ophthalmoplegia, and ataxia. The nurse suspects hepatic encephalopathy, Wernicke's encephalopathy, alcohol withdrawal, meningitis. Question 13. A patient with acute psychosis is becoming increasingly agitated and making verbal threats. The nurse's priority is administering antipsychotics, 1-to-1 observation, placing the patient in a seclusion room, contacting security. Question 14. A patient with a history of asthma presents with respiratory distress, minimal air movement, and an absent wheeze. This finding indicates the patient is improving, a silent chest, indicating severe bronchospasm. A pneumothorax. The patient needs a bronchodilator. Question 15. A patient in the ED is in ventricular tachycardia without a pulse. The nurse's priority intervention is: administer a miodaron 300 mg for push. Perform immediate defibrillation with 120 to 200 J biphasic. Start chest compressions. Establish an advanced airway. Question 16. A patient presents after a house fire with dyspnea, sooty sputum, and a brassy cough. The priority nursing diagnosis is: fluid volume deficit, impaired gas exchange, ineffective airway clearance, pain. Question 17. A 28-year-old female presents with lower abdominal pain and vaginal bleeding. She is 8 weeks pregnant. The nurse suspects: appendicitis, ectopic pregnancy, pelvic inflammatory disease, ovarian cyst rupture. Question 18. A patient taking sildenafil, Viagra, 2 hours ago now presents with chest pain. Which medication is contraindicated? Aspirin, nitroglycerin, morphine, atorvastatin. Question 19. A patient presents with a painful, swollen, and red leg after a minor injury. The nurse notes warmth and tenderness along the vein. This is most consistent with deep vein thrombosis, superficial thrombophlebitis, cellulitis, muscle strain. Question 20. A patient presents with a fever, headache, and neck stiffness following a recent tick bite. The nurse suspects: Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, anaplasmosis,